Well, from protecting your brain to protecting your skin, among Caucasians, men are most likely to develop skin cancer. But when it comes to Hispanics and Asians, the opposite is true. Joining us to talk about why that is Dr. Richard Chaffoo. Always great to see you, doctor.
Good to see you, Jen.
So let's talk about this first one. In a recent study of 4,000 cases of non-melanoma, meaning the non-very serious type of skin cancer, when it came to Asians and Hispanics, 2/3 of the cases happened in women. So what's going on?
That's right, Jen. And the issue has always been that we've looked at skin cancers, and the usual prototype for the non-melanoma skin cancers were usually in older Caucasian males. But Jen, what we found is that we think that while we're seeing an increase in darker skinned individuals, Asian, Hispanic patients, is because there's the change of tanning beliefs that groups that have come to the United States have adopted some of our bad habits of tanning excessively, and also the misconception that because you have a darker skin type and you have more melanocytes that you're somehow protected from skin cancers. And actually the opposite is the case because of those changing habits with tanning, and also because people may go to see the doctor later, that these patients are actually getting diagnosed later with skin cancers.
Let me talk in general, because you bring up some really good points there, regardless of race. When I was reading a little bit more on this, 20% of Americans, 1 in 5, will develop some type of skin cancer in their lifetime. So you mentioned tanning beds, sunscreen. How much does really sun exposure, whether real or fake, play into your risk of getting skin cancer?
Well, Jane, you're right. It's really the pivotal issue is that sun exposure is the primary cause for skin cancer, certainly whether we get that from the sun or whether we get it artificially from tanning beds. And we do know, talking of tanning beds, there's no regulation that the FDA has imposed upon those. People that tan regularly will have at least a 12 to 20 times increased risk of getting a skin cancer in their lifetime as from regular sun exposure, but certainly it's that ultraviolet radiation, UVA and UVB, that causes the skin cancers, both the non-melanoma as well as the melanoma. So we've seen this Hispanic cancer rate really jump almost 20% in 20 years, and it's because of the factors we've talked about. And unfortunately, 1 in 4 survivors from skin cancers do not wear sunscreen regularly. They represent 2 to 4% of all cancers in Asians, and there's this misconception that having darker skin somehow protects you against a skin cancer, and that really 3/4 of the tumors occur on less pigmented skin. So for example, melanomas, which are the deadly form of skin cancers in black patients, Hispanic, Asian patients, tend to be more in non-pigmented areas like the palms of the hands, the soles of the feet, the mucosa of the oral cavity, and so they're oftentimes diagnosed later.
Yeah, I got to tell you, of all of those stats that you just read, the fact that 25% of survivors do not wear sunscreen is remarkable to me. I hope we can change that through more education like what we're doing with you. Let me ask you lastly, Dr. Chaffoo, like so many cancers, we talk about this often, self-detection, paying attention to your own body, right? You know it the best, is really the key. So talk to me about what you would recommend for someone if they have a mole or if they are potentially concerned about a skin cancer.
Sure, Jen. So the things to remember are A, B, C, D, E. So if you have a mole, if there's an asymmetry to the mole doesn't have a nice even balance of either pigment or shape. The other would be the border of the edges of the mole would be irregular instead of nice and circumscribed. If the color varies from different locations in the mole, and basically if you cannot cover that mole by a pencil eraser, in other words it's more than 6 millimeters in diameter, and there might be some evolving traits. For example, there may be some ulceration or bleeding, irritation, rapid growth changes. Those are certainly indications to get in immediately to see your skincare specialist, your dermatologist.
Yeah, always some great points. Dr. Chaffoo, always like having you on our show. Thank you so much.